Do you see how this results in, oh my gosh, these people get me? That's what happens subconsciously. The D, I, S, or C, every patient says, oh my gosh, these people get me.
How can the DISC personality styles be applied in case presentation?
Yeah, great question. Well, again, I put Chris on the spot for that interview with literally maybe 5 minutes of prep time. I said, Chris, I'm gonna ask you how you would change your case presentation style to the high D, the high I, the high S, or the high C patient. And I gave him some tutorial on what the world of case presentation is about. He instantly got it. And he instantly was able to provide examples. But let me give you the example. Let's go through each one of them. I'm going to use the same case, Naren. And the case is a missing second molar that we're recommending a dental implant and an implant restoration for the missing second molar. Okay. And let's say the missing second molar is on the upper right, just for example. So does that make sense on what case I'm describing, Naren?
Yeah.
So the D, remember the D, just the facts, sound bites, makes decisions quickly, and they don't need a lot of information. So Naren, I'll use you as a patient. Hey, Naren, first of all, it's been great to get to know you as a patient. I'm looking forward to getting you taken care of. And we've talked about that missing tooth on the upper right, Naren. Naren, if my father had a missing tooth in the same spot as you, I would do a dental implant for him. The reason why I would do a dental implant is because I can now deal with a single solution rather than the bridge, which involves 3 teeth. I can do one solution. It's going to be a long-lasting result. It's going to provide the strength and the appearance and the functionality that I would want. I would do that if my dad had the same situation as you. I'd like to do the same thing for you.
So you're saying to the point.
To the point.
Yeah.
And I do like to use the analogy, and I would adapt it based on age. Naren, if you were younger, I might say if my brother had that condition. So you would relate it. If it was a female patient, I would use mother or sister.
Got it.
So it relates. Now let's go to the eye. Susan, it has been such a pleasure to get to know you. Man, I wish all my patients were as pleasant as you. So pause. You think the D wants to hear that?
No.
The D's like, get on, I gotta go.
Yeah.
I gotta go.
Let's get to the point.
Cut to the chase.
Yeah.
Susan, it has been so great to get to know you. I can't wait to get to know you even better. I wish all my patients had the personality that you have.
Asking questions, having more conversational, even a personal
warm it up
set of questions would be perfect with an eye.
With an eye, yeah. Now, I'm going to quickly switch gears to clinical. Now, Susan, we got to talk about teeth. I wish we could talk about your dog for the rest of the afternoon because your dog sounds like a kick in the pants. But we got to talk about teeth because that's why you're here. One of the things we've talked about is that tooth on the upper right that's missing. What I'd really love to do for you is to provide a dental implant. I can tell from the records here that you have lots of bone. You're a perfect candidate for a dental implant. And I don't know if you've ever been concerned, Susan, but if you smile really large, you can see that you're missing that tooth. By replacing that missing tooth with a dental implant, we're going to give you a much better appearance when you smile very large. And it's also going to allow you to eat anything you like. And if my sister had the same condition that you have there, I would recommend a dental implant for her. Now, what I didn't tell you in lining this up, is that the eyes are typically very interested in appearance.
I was going to ask.
Think about it. They're front stage. They're on stage.
Yeah.
You think the S's and C's are interested in functionality or appearance?
Functionality.
Yeah, because they're backstage.
Yeah. So so this acceptance by others is important for the eyes.
Absolutely. In fact, that is a dominant interest of theirs, acceptance by others. By the way, eyes are the best people to ask for referrals. Why, Naren? Why are the eyes the best people to ask for referrals? They know everybody.
Oh, right.
They know, and they love people. Right. They're also the best one to ask for reviews because they will write love letter reviews that you won't get a 2-word, a D patient on a review.
2 words.
Great office. Next.
Yeah.
Okay. S's. Remember, S is slow to make decisions. They like lots of information. So same condition. Naren, it's been wonderful to get to know you. I really appreciate patients like yourself that love details, because we like to pride ourselves on being an office that's all about the details. You know, we talked about that missing tooth on the upper right. You're an excellent candidate for a dental implant. You know, one of the things that I'm quite proud of is over the years, I've pursued a massive amount of continuing education in the area of dental implants. And I have a fellowship in, and you might explain, you know, the area that you had the fellowship in. You know, Naren, we've covered lots of information today. I had my team put together a 2-pocket notebook with some more information about dental implants. I'd like to leave that with you. And I'd like to invite you to be back in touch with me. I'm sure you're going to have some questions as you go through that. Be back in touch with me. We can actually do a virtual consult. We can continue the discussion. You can be at home. I can be here. I have all the records we need. We're ready to do that when you are, but I want you to get all the information you need so that you can make a good informed decision about that dental implant. So in other words, I don't push for a decision with the S. The C is very similar, except I might even go into more detail. Naren, the dental implant is actually a titanium anchor that becomes an artificial root to replace that tooth that's missing. The technology that exists today, by the way, dental implants have been around for over 4 decades now, and we have massive studies on the longevity of the implants, and they've been continually improved. I'm going to use language like that with the C. But same thing. Naren, I've prepared a 2-pocket folder. I printed out some things for you. I've also put some online websites that I think you might be interested in on dental implants. And when you're ready, love to help you with that dental implant. It's been great to know you. You know, Naren, I really appreciate a patient like yourself that values information and values, you know, going through all the information they need to make a good decision about their health. I wish all of our patients were like you. Let me show you another way to adapt this real quickly, Naren. Imagine the dental assistant that goes out to greet the patient in the reception room. Now, I'm assuming that our reception rooms are operating more normal terms, not COVID-19 terms, okay? So imagine Heidi going out to greet the high D patient. She's going to go out to the reception room. She's going to say, Naren, it's great to see you today. Come on, follow me back. We have you scheduled till 9 o'clock today. I'm going to be the timekeeper. I'm going to make sure we get you out of here right on time. Let's go. That's the D. Now imagine that Naren is the high I. Heidi's going to come out. She's going to sit next to you in one of the chairs next to you. Naren, it's so good to see you. How was your weekend? What'd you do?
Right.
Now, she's not going to do that with the D. The D is pissed off. Come on, let's go. I want to be on time.
I want to get out of here as quickly as
I want to get out of here. The I, what'd you do over the weekend? Oh my gosh. I saw your Facebook post. You went to that new restaurant. How was it? And she's not going to be out there for a long time, but she's going to spend 2 or 3 minutes. You know, come on back, Naren. Come on back. We'll talk more back in the laboratory. Come on back. Do you see how this can be done? And do you see how this results in, oh my gosh, these people get me. You know, that's what happens subconsciously. The D, I, S, or C, every patient says, oh my gosh, these people get me. Hey, thanks so much for watching this video. The full podcast episode link is in the link below. Don't forget to hit the subscribe button if you like our content.